Howdy, Practice Green Health community. My name is Iqbal Mian, and I'm coming at you to talk to you about energy and climate health. Last year, we spoke about how hospitals are the second largest users of energy by building type, and how they consume 8% of the nation's energy. Why does this matter? Well, because the burning of fossil fuels to make energy contributes to climate change, which we are quickly learning has implications to population health. Therefore, let's dive in with 3 facts on energy and climate health. Fact number 1. The World Health Organization reports that 1.3 million people die every year from urban air pollution. Now, the sad part about this is that children are particularly at risk due to their developing organ systems. Now, in China in 2013, the youngest lung cancer patient that was reported was an 8-year-old girl who was exposed to high concentration levels of air pollution. So what's the country's response in all of this? China is building renewable energy infrastructure faster than anybody. In fact, Greenpeace has reported that every hour a new wind turbine is erected and that enough solar panels are built to cover an entire soccer field. Fact number 2. Well, it's summer here, and you know what that means. It's wildfire season. And unfortunately, that season now is 2.5 months longer than it was 40 years ago. The National Interagency Fire Center now reports that from 1985 to 2015, the amount of acres that are burned from wildfires has increased from 3 million to 10 million acres. So what does that mean? This means that people who lose families and homes in those areas may experience post-traumatic stress, anxiety, grief, depression, and other negative aspects related to these climate impacts. Okay, fact 3. In 2016, from the Practice Green Health Benchmark Report, our hospitals in the community reported a reduction of energy by 1.3 billion kBTUs. That's enough energy to power 40,000 homes a year. Wow. It also means that the average hospital saved over $75,000 per year in energy cost. So let's curb our appetite on fossil fuel for energy by looking at reduction opportunities and renewable energy sources depending on your region. Now I'm going to turn it over to my good friend Shanda, who's got a message to all you nurses out there working on the front lines and with patients and community every day.
Nurses, we are critical messengers. The challenge is we need to spread our trusted voice to help accelerate the adoption of sustainable practices. And the reality is there are more deaths from respiratory air pollution than HIV, tuberculosis, and malaria combined. It is up to us to rebrand climate change as a public health issue. And in the United States, we make up a workforce of nearly 3 million people. 3 million! If nurses work together, we can help the healthcare sector take leadership in addressing climate change.